Okay, so we're going to go over the tracker a little bit more. I know I talk fast and things have changed a little bit on here. So again, when you log on, it's going to put you on this TMC Doctor tab. You want to go to TMC All Beds. Right now it's on the None. A lot of people use this to see. I find it difficult to see which patients are available, so I always go to My Patients and Unassigned. And so now you can see there's a couple more patients to sign up for. You can tell because there's no one assigned. So I'm going to click on the little doctor here. I'll take both of these. And because I'm on my laptop, I can't really see the vitals, but here we go. So again, there is another My Patients and Unassigned underneath this one. This one takes away their disposition after they've been dispositioned. So you can see I've got a patient here in bed 8 with a house next to it, meaning they've been discharged, waiting to go home. If I went down here, it would just have my active patients. That's fine. The only problem with that is if it's an admitted patient still in the ER and the nurse asks you to add something, you've got to go back up here and toggle and either go to None or the other My Patients Unassigned. So whichever you prefer. So again, you've got the room, the name, age, chief complaint. Um, Labs, looks like you can see this one's got a check mark, so all the labs are completed. But you don't want to wait until that check mark is there, because if it's something like a blood culture, a urine culture, something that we're not going to get back in the next, couple hours, it might not ever be all check marks. So you might have everything you need before it's all check marks. So just hover over it and see if what you need has been completed. Got your radiology columns, hover over to see if what you ordered's been done. And better yet, you can double click and see if there's been a dictation. And I want to show you this comment section. This is hard on my home computer. On the hospital computers, you can see everything. So here is a comment section. We use this to communicate with the nurses, and our nurses use it to communicate with us. It does not go in the patient record at all, so you can just double click in here and type whatever you need. Need UA, or need orthostatics. Anything that you need or that you want to communicate with the nurse, it's always good to go talk to them, but it's also a good place to update or communicate. And they might write in here, need pain meds, and that's a good way for you to know without them having to come find you. So feel free to communicate stuff in this comment section. So the patient I just signed up for, Bernice Howard, I know that name. She's been here a lot, so I can double click again on this blue arrow. I'm on her row. I'm going to double click here, and I'm going to see her vitals. I'm going to scroll down because again I'm on the ED summary up here. I'm going to scroll down. It says she's here for dental pain, tiredness, out of thyroid and diabetic medications. Let's say I want to see her previous notes. I'm going to click on documentation. You can see all the recent visits. We're on all power notes. If I wanted to go to all physician notes, it's going to look pretty much the same unless they were admitted. Or you can go to all notes. You're going to see all kinds of stuff. Triage notes, nurse notes. It's a good way to find EKGs. That's how you see an old EKG. It's kind of sift through there. Or you can use the hospital Muse system. I usually just go to this section all and find an old one. But let's say I'm like, okay, I've seen the EKG, now I just want to go back to the other doc note. You go back up to the display, all power notes. I can just click and see what the other doc saw her for. And that's it for the tracker again.